The purpose of this role play is to allow applied learning collaborative students to observe the ideal version of a preventative wellness primary care appointment. While it's understood that in some healthcare organizations, some of these strategies may be difficult to implement, the goal is to offer students a diverse range of interprofessional opportunities to discuss pain and addiction and strive for the ideal. Throughout this role play, students will observe applications of the screening, brief intervention, and referral to treatment, or SBIRT, framework, which uses elements of motivational interviewing and culturally and linguistically responsive principles. SBIRT is a comprehensive, integrated public health approach to the delivery of early intervention and treatment services for persons with substance use disorders, as well as those who are at risk for developing this disorder. SBIRT is aligned with many aspects of the 2022 CDC Clinical Practice Guidelines. The role play you're about to watch is situated in a rural integrated primary care setting. The patient is visiting the doctor for the first time as part of their wellness check.
Hello, welcome. My name is Leah. Please sign in. Would you like to be referred to as Esperanza, and do you have any preferred pronouns?
Actually, I prefer Hope, and I'm a woman.
And Hope, I see you brought some support with you today. Are you a relative?
Yes, I am Selena, Hope's mom.
And would you like to be referred to as Selena?
No, actually, I would prefer to be called Cece. Everybody in my family has nicknames.
Some folks in my family use nicknames too. Has anything changed since you first made the appointment?
No.
And do you folks have any questions I can answer now or refer to your health consultant?
Actually, it was a long drive here, and I need to use the restroom. Where's it at?
It's just going to be down the hall to the left.
Leah updates the electronic chart with patient's preferred name and a note about the long commute to the healthcare organization and writes NA for questions.
If you don't mind filling out this health form, it's just going to ask you some questions about your health, diet, substance use, mental health. There may be some questions that are difficult to answer, but a pure and accurate response will help Dr. Gabby and Cece both find the best care for you. And if you don't mind, you can discuss with Cece, or if you prefer to do it alone, Cece, I'm going to ask you if you can just be a quiet observer. Any questions?
No. I'll do my best.
Yeah. I'll take your stuff. Okay. Again? Okay.
Hope and Cece?
Yes?
I can take you back now. I'll check that. Thank you. My name is Jose, and I'll be your nurse for today. It's a pleasure to meet you both. We recognize that long commutes are very difficult to make, and we value your time. Just out of curiosity, how long does it take you roughly to get here?
No. That kind of depends on who's driving.
Really depends.
I'd say about 45 minutes.
That is a long drive. I'm happy to let you know that we are starting right on time, and we'll work to be more efficient in our time together. Let me start by getting your vitals.
Jose gathers temperature, blood pressure, pulse, and weight. Jose's reviewed Hope's chart and recognized that the TAPS screening indicated potential problem with opioid use. Jose collects extra information using the Clinical Opiate Withdrawal Scale, COWS, for Dr. Gabby to review when she meets with Hope. Jose records the score as 0.
All right. Your vitals look perfectly healthy and normal. This tells me that you've been engaging in healthy behaviors and activities. We like to acknowledge positive aspects of a person's life. And your vitals look great so far. Is there anything that you would like me to ask Dr. Gabby for you? Sometimes when the doctor walks in, people tend to forget their questions.
Yeah. I've been getting lightheadedness, and my mom's real worried about it.
Yeah, we're really worried about her lightheadedness. It's a concern for me. And I know that I have high blood pressure, and high blood pressure runs in our family. So I just want to make sure that she's okay, and just making sure that the doctor checks her lightheadedness.
Okay. Hope, is that okay with you? That if I include this into your chart?
Yeah, of course.
Okay.
Jose updates the electronic chart with vitals, Hope and Cece's concerns, and observations about the strengths of the patient and her mom.
Well, you just stay here, and Dr. Gabby will be with you in a short minute.
Okay, thank you. Thank you.
Hello. Hi, Hope and Cece. I'm Dr. Abdul, but you can call me Dr. Gabby. Nice to meet you. Is English okay for our visit today?
Yes.
Great.
Thanks for asking.
Yeah, absolutely. How are you all today?
Doing okay.
Good. It seems like you all had a really long way to get here. But it looks like your vital signs look great. And Jose put in here that you're really engaged in a lot of health promotion activities, so that's great. Yeah. And you have a lot of support from your mom. Is that correct?
Yes.
That's wonderful. So it looks like also Jose wrote that you have some dizziness or lightheadedness that you're a little concerned about that you wanted to talk about today.
It happens most days.
Okay.
A few times a day.
And how much water do you drink?
Oh, I drink a lot of water, like pretty much all I drink.
Good, that's great. Well, that is one thing that I'm going to add to one of your strengths and really does reinforce that you're involved in a lot of health promotion activities. The reason why I'm asking about your water intake is that I'm trying to rule out other causes of your dizziness. So one of the main causes can be dehydration, but it sounds like that's kind of not what's going on, so that's great. There is something that you filled out on your form that I would like to ask you about. Would that be okay?
Yeah, sure.
Okay, some of these questions can be a little bit sensitive, so is it okay if your mom stays in here, or would you like her to step out?
Oh, yeah, she knows everything about me. She's fine to stay.
That is wonderful. I love that open communication and open relationship between the two of you. We know that that can really support overall wellness. So the question that I had was actually about your drug and alcohol use question.
Oh, I don't do drugs.
Yes, absolutely. And you wrote that you don't do any what we call illicit drugs like heroin or cocaine. But you did answer yes to the question about if you took an opioid that wasn't prescribed to you in the last 30 days.
Oh, yeah. My mom had a procedure done a while back, and I hurt my back, so I've been taking some of her pain meds.
Yeah, so I had a procedure probably about like 9 months ago, and there was some leftover that I kept just in case for these kind of circumstances, and so I gave her a couple because she was in so much pain.
Okay. I'd like to talk a little bit more about that. I'm a little concerned about that, but first I'd like to learn a little bit more about your back pain.
Okay, so it happened like a year ago. I was working at a produce distribution center, and I was lifting like this heavy crate, which I've done like a million times. And I don't know, I guess I didn't squat properly, and I lifted and I buckled up. And I had like intense pain all the way from like my lower back, this side, all the way down. And they didn't know what to do, so we called 911. And I ended up in the emergency room. I didn't think it was an emergency, but anyway, they prescribed me some meds there and told me to take it easy for like a few weeks. And I took some time off of work. I went back to work, and I started taking her pain meds, and they really help.
Well, thank you for sharing with me how you hurt your back and how you've been managing your pain. I am definitely a little bit concerned. Is it all right if I offer some suggestions?
Yeah, sure.
Okay, great. So I'm a bit concerned that your dizziness might actually be related to the opioid use or the OxyContin or oxycodone. These medications can be really powerful pain relievers, but and they can be helpful in the short term, but for most folks using them long term, actually the risks really can outweigh the benefits. And so, I'm a little bit just concerned kind of about that. How often do you think you're taking them?
Honestly, like, I'd say about once a week, just to like relax.
Okay. Thank you for sharing that with me. And do you know what the dose is?
It's about 10 milligrams, I believe it was.
Okay. Great. Thank you. I'm really glad that you're not taking them super often and that it's a really low dose, but I'm still quite concerned about your use of them. Opioids can be really dangerous, and it's really important not to share prescriptions. And I understand why you would, because you want to help your daughter, but it's best if you either finish the prescriptions or dispose of them properly, especially in the case of opioids, because using them long term can cause issues like an overdose where someone needs to go to the hospital, or can even cause opioid use disorder, which is sort of a form of being addicted to those medications. I actually have a couple of pamphlets here on information on opioids, and the first side is actually in English and the other side is in Navajo. And there's a little QR code here as well, and you can go to that site and read a little bit more about it as well.
Yeah, thank you for this. I feel really bad, and I think feel it like it's my fault. No. Most people don't know, and that's why I'm just glad that you are here so that we can create a really good plan for Hope. So Hope, on a scale of 1 to 10, how committed do you think you are to getting back pain relief without using the opioids?
Without using, I'd say a 9.
And why would you say it's a 9 instead of, say, a 2?
I mean, it really hurts, and I want to get better.
Okay, that's great. Great, I'm glad that we can help you with that. And Cece, how committed are you to supporting Hope in her journey to pain relief without opioids?
I am committed to make sure she's healthy.
So it's really great that you're so committed to helping her, because a lot of the treatments for low back pain are things that take a lot of effort on the part of the patient. So like physical therapy and meditation, and it's also some things that take a little bit more time. So it's not like you get instant relief with those, and they can really be helpful, but it takes time. So I'd like to discuss a little bit of a plan of care, and would also like to order some tests to rule out some other things. But before we do that, I'm just going to really quickly check our prescription monitoring program just to see if you were prescribed any other opiates in the past.
Dr. Gabby checks AZ-PMP. Hope was prescribed tramadol in the emergency department, and there is no record of any benzodiazepine prescriptions. Importantly, many fatal overdoses are a result of polysubstance use or polypharmacy. Checking the AZ-PMP to ensure the patient hasn't been prescribed medicines that could result in adverse consequences is a legal and ethical practice.
Okay, it looks like you were prescribed tramadol. Was that helpful?
Yeah, but honestly, her meds were better.
Okay. In a little while, I'm going to have Dr. Frank Perez come in, who's our pharmacist, and he can discuss with you the opioid pain medication and also the meds that I'm going to prescribe to you, and then we'll have Maria come in for some additional resources. I would also like to get an x-ray of your back just to make sure that there's not something that we're missing, like a little fracture or something that we need to take care of. And then, like I said, I would like to put in a referral for physical therapy for you. I think that will be really helpful. And then after that's all done, I would like you also to see our pain specialist. Does that sound reasonable?
Yeah,
That sounds good.
That sounds good.
Great. And actually, before we wrap up, I wanted to ask you an additional question. Do you know if you've ever been tested for hepatitis C or HIV?
I don't think so.
Okay, great. The reason why I ask is that the CDC, or the Center for Disease Control and Prevention, actually recommends that everyone who is over the age of 18 get a hepatitis C test, and everyone who's between age 13 and 64 gets an HIV test at least once in their lifetime. The reason for this is that these are conditions that, if we find them early, are really treatable, and actually in the case of hepatitis C, there's actually a cure for that now. So we like to recommend testing for those so that we can initiate early treatment. If you're interested in either of those screenings, I have a little bit more information on these brochures right here, and you can take a look at those. And if you'd like to get those tests done while you're here, we actually have a lab in our clinic, so you can stop by, get your blood drawn, and then you won't have to take that really long trip here just for the lab work.
Small rural healthcare organizations may not have a laboratory for testing. In this instance, it's best to work with the patient to combine appointments or other strategies.
I actually didn't even know about the cure for Hep C.
Yeah, and actually HIV has lots of really good treatments as well, especially if initiated early. And so that's the reason why we recommend all of these tests for our patients.
Sounds great.
Great. Well, it was really nice meeting you both. I'm going to have Dr. Frank come in and explain all your medications. Have a great day. It was a pleasure. Yeah.
Dr. Gabby inputs notes and billing code CPT 99408 into the electronic health record. Commercial insurance, Medicare, and Medicaid all have billing codes to reimburse for SBIRT services.
Hello, Hope and Cece.
Hi.
I'm Dr. Perez, but I prefer if you call me Dr. Frank. I see you have numerous health-promoting activities such as drinking lots of water and very important family support. Dr. Gabby asked me to connect with you on your medication and talk about safe disposal and storage of the medicine. Is that all right with you guys?
Yeah.
Dr. Gabby is prescribing you with 500 milligrams of naproxen. She'd like you to take this twice a day with food or as needed. She's prescribing you with 7 days worth of medication because at the point where you're done with the medication, we will already have new appointments scheduled and we could discover our next steps from there.
Okay.
Hope, I'd like you to know that there are risks associated with this medication if not taken as directed. It can cause internal bleeding in the stomach, which is why we'd ask you to take it with food. If you have any abdominal pain, please contact us immediately. Now I'd like to talk about safe storage and disposal of the medications, but I'm curious of what you guys already know about it.
Oh, you put the lid on tight?
Yeah. You are correct. Would it be okay if I share some other information?
Yeah.
Yes.
Opioids do carry benefits, but they also carry risks too. First, ideally, we'd like to store the opioids in a locked box, somewhere way up high where the pets or the littles can't reach it. Second, when you finish taking the medication, I'd prefer if you crush the pills, and we'd like you to put something that little kids or pets won't be attracted to, such as coffee grounds or kitty litter in them, so that no one will be inclined to look inside the bag. Cece, does that sound like something you can do in the next day or two?
Yes, I can do that. Thank you.
Great.
Opioids have the potential for overdose. Opioid overdose is when someone stops breathing. The signs of an overdose are unable to wake up, unresponsive to stimuli like someone shouting or rubbing the clavicle or sternum. Other symptoms are pinpoint pupils and or gurgling sounds. If this happens, call 911 immediately and follow directions from the emergency personnel. Then take naloxone out of the package. Put the nozzle into the nostril and press the plunger. Make sure to press the plunger all the way to ensure all the medicine is released. Wait about 2 minutes. If the person doesn't become responsive, give the other dose. Make sure to stay with the person until help arrives. If they wake up, they'll most likely be confused, and you'll need to explain what just happened. Then encourage the person to seek medical care, even if they're reluctant to do it themselves. Naloxone should be co-prescribed with all opioid medications. Healthcare providers are required to complete continuing education on substance use as there are changes in the type of accidental and intentional poisonings and overdose. For example, in 2024, we're seeing an increase in psychostimulant misuse, which may have implications for prescribing stimulants. Also, alcohol misuse has been a consistent health issue in the United States, and with the legalization and social acceptance of cannabis use, these are important discussions for healthcare practitioners to have with their patients and families.
I'd like to pause because I know I just shared a lot of information with you guys. I'm curious if you guys have any questions.
No, I think I'm good.
Mm-hmm. I just want to emphasize, Hope, that if you follow these instructions, you will be well informed and safe. Now let's bring in Maria.
Hi, Hope and Cece. I'm Maria.
Hi, Maria.
It's nice to meet you. So I heard you had a lot of information today, and I'm just going to provide a few more details about some community services that you might like to engage in.
Maria reviews the social determinants of health screening Hope completed earlier. The screening is called Protocol for Responding to and Assessing Patients' Assets, Risks, and Experiences.
So I see that you've had a long commute and might have some difficulty managing appointments. So I want to let you know about a community shuttle that we have that can bring you to and from the clinic if that's something you'd be interested in.
Sounds very
Transportation would be really helpful for us since there's only 2 of us.
Totally get that. The other thing that we have is, if you have capacity, is telehealth, and that will reduce your having to come to the clinic at all.
Okay, that sounds good.
Wonderful. The other thing that I want to tell you about our other patients really like is our support groups for mindfulness and physical therapy. And so these are some options for you as well.
That's great.
And so what I'll do is I'll share this information with the care manager, and they will be in contact with you with scheduling some additional appointments. Does that sound good?
Yeah.
The last thing I want to tell you is that sometimes medical bills can be really difficult to understand. So if you have any questions, I can walk through the bills that you receive and just let you know what's being charged and what all those codes mean.
That'd be good because bills can be really confusing.
I completely get that. We want to be here to be supportive of you and make sure that we reduce as much stress as possible during this experience. Here is a folder of additional information, and I will be in touch in the next day or two. But if you have any questions or things that come up, please feel free to reach out. We're here to support you. Thanks for coming in.
Okay,
Thank you very much.
Remember, this example is the ideal situation. We recognize that healthcare organizations have varying levels of practitioners, resources, and support. Healthcare organizations can think about ways to utilize other types of services to expand their services. For example, in the absence of an on-site pharmacist, healthcare organizations might use telemedicine, poison control centers, provider-to-provider options, or opioid assistance lines. We want this training video to be a resource for improving core knowledge, collaboration, and clinical practice. Thank you for your interest, and thanks to all the people who contributed. This video was developed as part of a National Academy of Medicine's 3Cs framework for pain and unhealthy substance use pilot project aimed to expand core competencies in interprofessional education and practice. This video was developed in part from funding from grant number CDC RFA CE19 1904, funded by the Centers for Disease Control and funded to the Arizona Department of Health Services. The contents are solely the responsibility of the authors and do not necessarily represent the official views of the CDC, HHS, or ADHS. It was also funded in part through a Career Development Award to Dr. Bridget Murphy from the University of Arizona Health Sciences and Mel and Enid Zuckerman College of Public Health. The information in this video is designed for educational purposes only. This information does not substitute, nor does it replace the advice of a medical professional, including diagnosis and treatment. Always seek the guidance of a qualified health professional with questions you may have regarding any medical condition.